This next section, we're going to discuss identifying critical stakeholders. And this also is directly related to the Coalition Project. So who are stakeholders? They are the public health constituency, the people and organizations who benefit from public health actions and also support public health actions. Remember when we discussed all the different types of organizations that are part of it, assuring the conditions for public health, for population health. This slide should look familiar since we used it in week 1. So as you can see that there are lots of different stakeholder groups that should be involved in assuring conditions for population health. The community and its members, particularly those who are leaders and communities that can speak to the needs of the community. Governmental public health, the healthcare delivery system. This can include hospitals, primary care settings, outpatient settings, all the different aspects of healthcare delivery. Employers and businesses, they are impacted by population health, and they can have a positive impact as well. Media, we have seen the use of social media as well as traditional media to help increase exposure to different public health ideas, and then academia. So from this list, there are many potential partners and stakeholders. So you should definitely refer to this slide when thinking through your stakeholders for number 4 in the Coalition Project. In addition, you want to make sure that you address and identify policy and regulatory officials, such as the mayor or other elected officials. And when you are listing the potential partners and stakeholders for your project, do not list professional associations. You need to identify which professional associations are going to be important to your project. So if you're interested in decreasing breast cancer in African American women, you may want to include people or representation from the American Cancer Association, for example. So if your organization or your focus is in East Tennessee, and you talk about schools, colleges, and universities, you could identify the University of Tennessee in Knoxville, East Tennessee State University, Milligan, Walter, like the community colleges, whomever. If your organization and focus is in West Tennessee, then I'd like to see organizations and universities and partners that are real, live, living, breathing organizations and individuals in that community. So you'll have to do some digging to understand the community in which you're targeting. So this should be real, live people and organizations. So it would make no sense if you are working in Shelby County and you say, I'm going to work with the Northeast Regional Health Department. Well, that would not be the most efficient and appropriate governmental public health agency. But the Shelby County Health Department would. When you're looking at different specific businesses and employers or healthcare organizations, those should be located in or near the community that you're serving. Okay, so to describe alternate strategies for collaboration and partners. There are different functions for partnerships. One could be service delivery. So this would be to partner with organizations to provide services and or reach out to people in the community. For planning and policy development. Surveillance and assessment. This could be collaborations and partnerships between governmental public health, hospitals, laboratories, to really do surveillance and assessment. We often see and think about this when we look at the community health assessment and the community needs assessment, which are two different assessments that are part of the purview of both public health and healthcare. For public and professional education, this we think of around CMEs or continuing education, either nursing, medical, dietitian, whatever organization or specialty you're in, or for outreach. So for number 6, you're going to define what the structural characteristics of your partnership. You can think of both formal relationships and informal. You're probably members of informal collaborations in your personal life and professional life already. One, for example, would be a running group. So I've been running with a group. We meet on Tuesdays and Saturdays. There are no contractual agreements. I didn't have to sign something to join or be a part of the group. There are no real rules and regulations. It's very loose. But when we think of formal relationships, these have contractual agreements. They have plans for shared governance and shared ownership. So when thinking about those informal collaborations, you may have a study group that's informal, a running group or an exercise group, maybe a faith or faith study group that you're a part of. There's typically no formal leader. Someone may take that leadership role as we talk about those informal leaders. They may send out the email and remind everybody we're getting together at the Tweetsie Trail at 6 o'clock on Tuesday, and we're gonna run 6 miles. There are no policies or procedures. There are unwritten norms that govern behavior. So if I say I'll be there, they expect me to be there on time too. So they're not just waiting around to make sure that everyone who said they're going to be there is there and that they don't leave anyone behind. If you're in a study group, there may be specific times when you lead a study session, and your group members expect you to be there and do that. And then the leader is to recognize their existence and understand that they can provide an important gauge on the health of an organization. Now, these informal collaborations are common typically when we have partnerships between hospitals and health departments. They may have some loose agreements between organizations that have a long history of working in the same community, and so therefore they depend on their relationship to enforce those unwritten norms. So they're easy to develop and maintain. They're flexible in nature but hard to enforce. So if people start to lose their interest or stop fulfilling their duties, there's not much you can do. So if people just stop showing up at the running group, they can't fine me or dock my pay. So there's no real enforcement if people lose their interest in the group. So formal collaborations, there are boundaries. They have distinct member roles with specific tasks that are performed and measured. And the leader, it's important for them to understand how to craft and nurture teams that are effective, productive, and satisfying the members. There are different models that exist to formalize relationships. And so on your coalition project, you're going to identify if it's a formal partnership, informal, and what kind of formal collaboration. Typically, we often see groups selecting a formal collaboration, but there are different models, such as contracts versus shared governance. So you will decide as a group your model, informal or formal, and then how to formalize that relationship.